The characteristic symptoms of schizophrenia involve a range of cognitive, behavioral, and emotional dysfunctions. There's no single symptom that's indicative of this disorder. The diagnosis involves the recognition of a range of signs and symptoms associated with impaired occupational or social functioning. Individuals with the disorder vary substantially on most features, as schizophrenia is a heterogeneous clinical condition. The diagnosis of schizophrenia involves two or more of the following symptoms. They're significant if it's for a 1 month period or less if successfully treated. At least one of these must be delusions, hallucinations, disorganized speech, disorganized behavior, and negative symptoms. These symptoms are significant if it's over a long period of time. Developmental challenges of individuals with child onset schizophrenia include lower educational achievement, cognitive impairment. The outcome is much poorer than if it were adult onset, and social impairments.
So here are some stats about schizophrenia. It affects about 20 million people worldwide, around 2.2 million people in the United States alone. Over 69% of people are not receiving appropriate care, and 90% of people who have untreated schizophrenia live in low and middle income housing. If you have schizophrenia, you are 2.3 times more likely to die earlier than the general population, and this is due to physical illnesses like cardiovascular disease, metabolic, and infectious diseases. If you are a male, you develop this disorder slightly earlier than females, normally between 16 and 25 years old, women around the age of 30, and the average onset is 18-year-old for men, 25 years old for women, and it's very, very rare to find schizophrenia before the age of 10 and after the age of 40, no matter what gender you are. One fact that I found interesting was about 20,000 homeless individuals are either manic or schizophrenic.
Over time, there has been many factors thought of as contributing to the development of schizophrenia. Some of those factors were pregnancy and birth complications, famine, drug use by the mother or that the mother experienced, child abuse, various parenting styles, stressful living situations, viruses that the mother maybe received or the child had, and neurodevelopment. During the course of normal brain development, some neural pathways are pruned. Literally, just think about a tree, how you prune a tree, those neural pathways are pruned. And that pruning can sometimes limit and disrupt dopamine production. And the lack of dopamine and the production of dopamine are essential factors in the etiology of schizophrenia. So currently, most of the research on the causes of schizophrenia are genetic in nature. Genetic heritability in twins is around 80% and around 50% with people with first-degree relatives. That's mom, dad, sibling, grandma, grandpa. Specifically in genetics, they're looking at, it's kind of a long word, as you can see, D-amino acid oxidase activator, and then a polymorphism glutamate. And you'll hear that comes up a lot in research, that GAD1 gene. That's kind of a relatively new awareness that gene plays a role in this. It's important though to think about the genetic predisposition a person has to schizophrenia. And I like to think about, other diseases that we experience, like diabetes or high blood pressure. We may be genetically predisposed to them, but that doesn't mean that everybody who has those genes necessarily develops that disease. So prenatal and postnatal complications may affect neurodevelopment. That doesn't mean somebody's going to get schizophrenia. Environmental stressors may impact development. Historical trauma is obviously another factor. But this kind of last point sums it up for me, which is just as environmental stressors have a role in influencing genetic diseases like high blood pressure, psychosocial factors likely have a similar function in the development of schizophrenia. So you know, all those other factors put together make this puzzle of schizophrenia. It's not just one thing. Childhood onset of schizophrenia can cause significant problems for the child's daily functioning. Schizophrenia causes progressive changes to the brain. Doesn't matter if you're a child or you're an adult when it occurs. There's literal decreases to the size of the frontal lobe, the parietal lobe, and the temporal lobes of the brain. And as I'm sure you know, we're all aware, any kind of changes like that in a brain are going to have significant impacts on a person's functioning. The National Institute of Public Health has compared MRIs of healthy adolescent brains to the brains of adolescents with childhood onset of schizophrenia and show a 4-fold decrease in the size of the brain. So, I mean, obviously that's a real problem for someone's functioning. Because of the reduction of brain size, children with schizophrenia suffer from more intellectual disabilities than their adult counterparts. And if anybody ever saw A Beautiful Mind, you know, some adults with schizophrenia are really high functioning and intellectually and really competent. And unfortunately, for children that get this disease, it's not quite as majestic, I think, the way that movie portrayed it. The decrease in frontal lobes impacts difficulty with working memory and memory. So like schizophrenic adults, children with this disease will struggle to maintain attention to tasks and have trouble processing information. Schizophrenia can impact a child's social and intellectual development. These children have a difficult time relating responsibly to peers, parents, and teachers. They may behave in ways that make their peers reject them. And generally, these children will struggle with appropriate sharing, playing age-appropriate games, and with other pro-social behaviors. I just kind of want to draw the similarity that obviously these aspects of schizophrenia are very similar to some of the other aspects of emotional disorders that children may experience. Children with schizophrenia will need support of special education services in school. Just like children with any emotional disabilities, they have language delays sometimes. They typically struggle with processing and understanding verbal language. That has a lot to do with those parts of the brain that the disease impacts. School avoidance is common for any child with an emotional disability. And the best thing as far as educational services could be wraparound supports. They would be critical for a child with schizophrenia. And the families, this is kind of generic. This applies to really any child with an emotional disability. At home, the child will need accommodations to function within the family structure. Again, wraparound services, which include educational professionals, therapists, parents, behavior specialists, possibly occupational therapists or speech and language therapists. And these children need constant support and care. Training and education for the parents and siblings and extended family and caregivers to know how to best help the child is important. And finding and building a support network for the parents. And one thing is the Individual with Disabilities and Education Improvement Act provides funding for training for parents who have children with emotional disabilities to help them build skills necessarily to help that disabled child achieve their educational goals. And I don't know, you know, that's one of those things. Parents that have a child like that really need to access all those services. So this is more about the emotional aspect of families would experience. Schizophrenia is a disability, and as with any disability, there are many stages that parents and families go through when their child becomes diagnosed with this disability. Receiving the diagnosis is just the first part of their journey. There's feelings of grief, what they dreamed of for their child, and grief about that is a normal reaction. And I think you can take it to the next level with grief, the different stages we know about, right? Denial, anger, all those things are very normal. Shock and fear for what that diagnosis means for their child and their family. Self-pity, denial, anger are all normal reactions. And at some point, it's hoped that, you know, people can move beyond the diagnosis and move toward acceptance of their child and begin to look for ways that they can help their child.
So how do we assess or diagnose people with schizophrenia? I think Nancy did a great job of explaining both with children and families how you can not only see these issues but also kind of help them out. And the DSM-5 does have a diagnosis for schizophrenia, but what are some things that we can see as social workers right off the bat? Well, their child's development is not as quick as the average person their age, both with social and language delays. I think as social workers, giving them support groups around a person with schizophrenia to try to be more understanding and know about these support groups for people with schizophrenia will be very beneficial. You can do this, especially in our digital age, the online and in-person groups. You can find people, no matter what the diagnosis is, you can find people with support groups online or in person. Well, acceptance from family and peers, and realizing this is a big one, the diagnosis doesn't completely define them. Yes, we have schizophrenia, but there's more to the person than that. And I think really establishing their strengths and weaknesses, mostly their strengths of this diagnosis, can be very beneficial if you do this as a social worker. And then we can change and elevate the mindset of someone with that diagnosis. This kind of tags along to what I just said, but we know about their weaknesses, but there's a lot of strengths they have too. There was a study done by Razia et al., which talks about healthy individuals with schizophrenia with people who have a diagnosis. And they say that there are potential features of people with schizophrenia that can be used during conscious experiencing satisfaction with various life events. The arousing of positive emotions results in positive consequences in the area of psychological and psychological functioning. What that just means is that, yes, we know that people with schizophrenia have language barriers and their brain does not develop quicker as other people, but we still have thoughts and feelings the average person has. And so utilizing those strengths and saying, yes, you are different, but here's the things that really establish you as a human being. Those are the things that we should look at as social workers, and really trying to establish normalcy as well with it, because we don't want to isolate people with schizophrenia or with any other diagnosis just because they're different based on one diagnosing.
Research has found 5 main community and evidence-based interventions that have been optimal for treating schizophrenia. The first one is cognitive therapy, CBT. Then we have psychoeducation programs, family intervention, social and coping skills, and case management. We're going to dive a little bit deeper into them on the next slide. But CBT has generally been recognized as one of the most effective treatments for schizophrenia. And it goes as far back as to the early 1950s with Aaron Beck, the creator and founder of CBT, cognitive behavioral therapy, who had described that he had a successful treatment of a patient he had that suffered from delusional beliefs by applying CBT. After that, there have been a lot of breakthrough studies done by Val Drury, who worked with the University of Cambridge in the 1990s, and whose main goal was to look at how cognitive therapy helps with psychosis. This was followed by many others. Most of the studies have actually been done in the United Kingdom because there has been a much broader dissemination of the CBT approach, because it's largely due to the endorsement, a formal endorsement by the National Institute for Clinical Excellence that does clinical research in the United Kingdom. So most of the studies have been there, but because there have been numerous studies, CBT has been found as one of the most effective treatments for schizophrenia. And then alternative approaches include psychodynamic therapy, behavior modification techniques that can include token economies, for example, as well as electroconvulsive therapy. However, there has not been enough empirical research to find evidence that they're actually effective when it comes to treating schizophrenia. And then the most important thing when talking about treatment interventions is that pharmacotherapy, so using medication, is the number one treatment and the number one most important treatment when it comes to schizophrenia, and is crucial when it comes to combination with other treatment methods such as CBT or psychoeducation programs. So CBT targets the impairment in function due to symptoms. So for most people with schizophrenia, daily functioning has been affected due to their disorder. So CBT really targets the cognitive symptoms, and it helps people with schizophrenia cope with their psychotic symptoms by examining and reevaluating their thoughts and their perceptions of their experiences and bringing them back into a more reality-based frame of mind. CBT has initially been designed to be helpful for people with depression. So a lot of people that are affected by schizophrenia struggle with mood and anxiety disorders. And those can be effectively addressed with CBT. As said before, most of the empirical research, other than using medication management through pharmacotherapy, focuses on CBT as an intervention. And then for psychoeducation, psychoeducation aims to help the person develop an understanding of the condition and how it plays out in different areas. This includes from a biological standpoint, social, environmental, and pharmacological perspective. And it's been found that often such an understanding can decrease the risk of relapse because they do have a more eclectic understanding of their disease and how it plays into their symptoms. And then we move on to family intervention, which combines both psychoeducation and training and problem solving for the whole family unit. Family intervention aims to help the family understand the condition. This is often done in the form of family therapy, and it also helps them understand how it does play out in different areas, both for the individual that's affected, but as well for the family as a whole. And such an understanding can increase the support and decrease the potential burden that the disorder might put on the family as a whole. Social skills training utilizes the behavior therapy principles and techniques that help teach individuals communicate their emotions, which can also help with meeting their needs for independent living, which are often lacking when they are experiencing symptoms of the disorder. And there has been a variety on empirical research done on social skills trainings, which are often used in other conditions as well, such as depression, anxiety, because independent living ability is often compromised when people find themselves struggling with depression, anxiety as well. So this can also be applied for people who struggle with schizophrenia. And then lastly, case management really focuses on care coordination and community support. So this means making sure that all of required treatment team members are in place, such as a therapist, a psychiatrist, as well as utilizing community support and resources. For example, if somebody requires help with housing or any other kind of resource that the community can provide, or food banks or whatever it might be, depending on the individual situation. Case management and case managers assigned to the individuals are very helpful in connecting them with those community resources. Pharmacotherapy is really the crucial point in treating schizophrenia, and it has been widely studied as pharmacotherapy has been one of the first interventions for schizophrenia. And pharmacotherapy utilizes antipsychotic drugs, which are aimed to reduce psychotic symptoms, which means hallucination and delusions for people with schizophrenia. And the different types of medication that are being used, or the different antipsychotics that are being used, can be categorized into first generation and second generation. So first generation antipsychotics, as the name implies, have been around the longest and were the first line of defense for people with schizophrenia. But the downside is that they have potential significant neurological side effects, which includes the possibility of developing a movement disorder, such as tardive dyskinesia is often discussed, and that may or may not be reversible. Such examples of first generation antipsychotics would include haloperidol, which is often known as Haldol and still widely used, as well as fluphenazine, which is used as known and used as a brand name Prolixin. And because of the side effects that the first generation antipsychotics often bring with them, as second generation antipsychotics emerged. And these newer second generation medications are generally preferred because they have a much lower risk of serious side effects than the first generation antipsychotics. And we oftentimes even find them being used in conjunction with other medication when it comes to other conditions as well, such as depression, because they don't have those side effects and because they have still have those very therapeutic features. But examples of those second generation antipsychotics would include aripiprazole, which is Abilify, quetiapine, Seroquel, and risperidone, Risperdal.
So some research questions that are important to understand how individuals and families deal with childhood onset schizophrenia are: what therapeutic models are most effective in treating schizophrenia in children? What side effects do parents experience related to their child's diagnosis? And how are they affected by their child's behavior? And how can outcomes be improved for children with schizophrenia?